Alright guys, it's Jerningham here. We're going to do some more of Matt Hancock's speech, Health Secretary. I'll put this on here. This is what else he's got to say for himself. Get the bloody phone to just stay there. There we go.
Why you thought that was, and therefore what lesson we could learn about that for the future. And if I could just one for Professor Newton, testing capacity has increased significantly, but still about a third of it each day is going unused. Just wondered how you plan to use that spare capacity, and whether it could be used for people who have been told to isolate by the track and trace test and trace system without symptoms to decide whether or not they do indeed have the virus. Thank you.
Thanks very much. On the first question, I'll take the first question, then ask Professor Newton to answer the second. On the first question, we didn't make a prediction of the impact of this disease, other than right at the start when there were scientific predictions made, which have been published, showing that
people in England can drive to the peak breaches only with members of their household.
And that led to a whole
lockdown measures.
A whole series of changes, including the social distancing and effectively the lockdown, because that was unacceptably high. And we are completely and fully transparent about the impact of the disease. And I welcome the
lockdown measures. Fine for breaking the rules in England range from 60 to 100. The fine will be doubled. Repeated offenders to a maximum of 300
and the number of deaths is coming down.
300 maximum of 300 and 200 pounds.
Given that that's been a very
lockdown measures outdoors, markets and car showrooms have opened. England, while other nations' retailers can be open in 2 weeks.
Priorities. The first is to support the test and trace programme, and the Secretary of State has said
government dates show the risk of dying with COVID-19 higher than black, Asian or minority blame groups than a white ethnic group.
And I should say, actually, we were asked yesterday about some of the statistics, but there are thousands of people already who tested positive, who've been successfully fed into
HMP says higher COVID-19 deaths treated among blame groups are a percent of seen proves of years. Mobility rates lower blame groups than white ethnic groups.
We recommend testing for people who don't have symptoms, because if you don't have symptoms, it is unlikely to be positive, and even if somebody who's incubating the virus, the test may well be negative. So if you have a test during if you're a contact and during your 14 days of self-isolation, if you have a test and it's negative, you still have to complete the 14 days isolation. So there is little utility in offering tests to people who are contacts, unless they develop symptoms, when of course it is worthwhile. The second priority is to support the NHS in infection control and other settings like care homes. So we're doing a lot of testing of staff to make sure that it's safe for people to be in a care setting or in the NHS.
Under the government's plans, international airlines must be safe isolated.
In those settings are coming down. So
airlines.
We are learning from those results to design infection control programs for the future. And then thirdly, we're using the test to support really large-scale surveys. So every now and again you see a blip in the numbers of tests done when we do a lot of tests for a survey, whether it's for the National Statistics or one of the other, the Imperial College Service. And so those are the three priorities for testing. We are using a good proportion of the test, and of course then there are the antibody tests, which are being rolled out first in health and care staff to understand how the infection has spread.
Can I just come back on your answer, Secretary of State?
Yeah, of course, yeah.
Thank you, because there were forecasts published by members of SAGE, Neil Ferguson, for example, and he said today that the UK had been much more heavily affected by the virus than expected. So I did wonder if there was any analysis going on, and if you could share any of that about why that might be, and how we could avoid, if there was a second peak or a future epidemic, how we can avoid those same things happening again.
Well, it's undoubtedly true that we've had a very significant impact from this virus. There's no doubt about that. And we've been learning all the way through it how best to deal with that. In fact, the test and trace system that we built over the past few weeks and that's been up and running for the past 5 days is one of the lessons that comes out of it, the absolute vital importance of having a system that is big enough to be able to trace as many of those who've tested positive as possible. And this in fact ties in with an additional answer I was going to give to your second question, which is that Professor Newton gave the long answer, if you like. The short answer to the question of the gap between tests done and capacity is that we have spare capacity. This is a good thing, but I would urge LBC listeners
if you are numbers lower than 1, virus can be more easy to contain.
Get one straightforwardly, go on the website, and you are not only protecting yourself, but you're also helping us to trace the virus and control it, and therefore keep the country safe. Thanks very much, Ben. George Parker from the FT. George.
Thank you. It's a question about the government's plan for a blanket quarantine, a 14-day quarantine of people arriving overseas. Question first of all to Professor Newton. What is the scientific rationale for having a quarantine against people coming in, for example, from a country like Greece, which has very low levels of coronavirus? And would you support the idea of an Airbrush between countries with lower infection rates from Britain into the UK? My question to you, Secretary of State, you said on May the 12th that people wouldn't be taking overseas holidays this year. Is that still your advice?
Well, do you want to go first?
Well, I should say, by the way, that I'm not a member of SAGE, and it would be SAGE whose advice is the basis for this. But the principles are clear that obviously we, just like in this country, if somebody might be at risk of having the virus, we need them to be isolated during any period when they might be infectious. And if people are coming into the country, then they really have to be treated as an unknown, and therefore there's a quarantine. Now, if there are two reasons why we might not do that. That would be if the risk of them having the virus when they come to another country is so low that we would just take the chance, that the chances of them becoming infectious are very low. And I think at the moment the judgment is that it's too early to say that, and therefore it's better to be cautious for people travelling. And secondly, if we are able to very quickly respond with a test and trace program, then we could cover it in that way. So if travellers are able to be tested and self-isolate in response to contact tracing, just like a domestic new case, then that would also be a way of dealing with it. At the moment, I think caution is one the day, and SAGE's advice is that quarantine is appropriate. But as I say, it's not my direct responsibility. But I'm sure those are the principles on which the advice is being given.
Thanks, George. On the specifics, I was actually asked this, I think, late last week, and I said I was more optimistic than previously. But clearly, the number one priority is keeping the public safe, and that is the overriding principle. And it has been throughout this, hence many of the changes that we've brought in. The next question is from Sarah O'Grady. Yes, of course. Sorry, I thought you want to come back.
Can I just quick follow up on that?
Sure.
Given that the UK has one of the highest infection rates in Europe, can you give any indication of which other European countries are interested in the idea of an air bridge with the UK?
Well, this air bridge idea has been floated, and I know there's been a lot of discussion about it, and I know that some countries have been mentioned in the media. But that is a piece of work that's being done by the Home Office and the DFT, and I'm not going to tread on the toes of my colleagues, no matter how tempting it is. Thanks, George. The next question is from Sarah O'Grady from the Daily Express. Sarah.
Hello there. My question to you, Secretary of State. The spotlight has shone on the pressures faced by our social care system through this coronavirus.
Lockdown measures people in England are returning to work, can't work from home.
I could tell readers of the Daily Express, what are your plans and what is your time frame for the long-promised radical reform of social care?
Well, I'm glad to say, Sarah, that we absolutely need to make those reforms to social care that have been, in my view, pushed to the side for too long. We made clear commitments in the manifesto, which was only back in December, and we have been working on that piece of work even during the coronavirus crisis. It's incredibly important to me that we put social care on a sustainable footing, and I think one of the positive things amid the terrible things that have happened during this crisis is that people have recognised social care as for just how important it is. And I think everybody who works in social care has seen the whole country value them. We need to follow that up with reforms to the way that social care is supported to make sure that more people get that dignity in their older age, and the people of working age who are in social care get the support that they need. So I'm very keen to, I'm determined to push forward the social care reforms that I know so many readers of the Daily Express are interested in.
Can you give me an example, please, of one of those reforms? Could you give us an idea of perhaps the time frame?
Well, the time frame has been clear, which is that we've got to get these reforms done in this Parliament, and the Prime Minister's previously said that we'd get them set out this year. That was before coronavirus. We'll still try to do that, but it is not straightforward. What I can say is that the crisis itself has demonstrated many of the reforms that are needed, like closer working and collaboration between health and social care, like the increased financial support, which we'd already committed to for social care, and then we put more in during the crisis, and making sure that some of the injustices in social care are taken away, especially about how it's paid for. Thanks very much. The final question is from Vic Matune from The Voice. Vic.
Secretary of State, many thanks. I'd like to ask two questions, if I may, and address them also to Mr. Newton. Given the disproportionate way in which COVID-19 has affected people from Black, Asian, and minority ethnic communities, there's understandably a lot of concern, a lot of anticipation about this report, the Public Health England report, and what it might say. However, the disappointing lack of recommendations is certainly going to affect many. Already we've had a number of emails from readers of The Voice citing this as another example of government indifference to the kind of inequalities that you mentioned earlier on in your address. How will the government address and reassure members of those communities that this isn't just another report? The second question I'd like to ask, as you know, the statistics show a clear link between the people working in public frontline communities, frontline jobs, and also their chances of contracting COVID-19. Many people from BME communities are in frontline jobs such as health, healthcare, transport, social care. But local authorities around the country have been very quick to protect BME employees through things like risk assessments. How will the government follow their lead?
Well, thanks very much, Vic. And in a way, the second question answers the first, in that we've already taken action because it's been clear right from the start. I remember that the first 4 deaths of doctors were all people from Black and Asian minority ethnic backgrounds. I think 3 of the 4 had come to the UK to serve in the NHS, and it really struck me, and this was right at the start, that there was clearly a disparity, and we've seen that disparity. And I think in your second question, you've touched on some of the reasons, and we need to do more work, which is why we've published this and are saying we're taking it further. Because the link to the occupations that people do is an important part of this conundrum. And putting in place risk assessments for people who are in high-risk occupations has been something that we've already been doing the work on. What we need to find out, and we don't yet know from this report, is what over and above the impacts of being in a certain occupation, like for instance, as you say, being more on the front line, and one of the biggest impacts is of people who work in transport, where you can't isolate, so like taxi drivers, and how much of the disproportionate number of deaths that we've seen from people from BME communities are due to the fact that there's a higher proportion of people from those communities who work in the sorts of occupations where the risk is greater, and how much is down to, for instance, the differences in housing, because we know that urban areas are more badly hit than rural areas, and so it's the wider co-determinants that we need to get to the bottom of, and that's the work that, along with PHE, that Kemi Badnock will be leading in the next stage to make sure we look as broadly as possible. And all the way through this, we've been putting in place the actions that we think have been needed from the evidence that we've got, and we need to keep doing that. John.
Oh, thank you, Secretary. Yeah, I mean, the purpose of the report was to try and get every bit of information we could from the existing data, try and understand how different factors work together. So not just ethnicity, but the other factors which are often working alongside ethnicity, and many people, of course, suffer from multiple disadvantages as well. So we're trying to put all that into context and really present it as clearly as we could. And it is complicated. Even after we've done the analyses, it is still a complicated picture. So trying to get that absolutely clear so that people could then take it forward and develop the right recommendations. And I think there's the way we would do this is it's such a way that the people who we're really trying to put the information into the hands of people who can use it to make a difference. And that's often, it's not us as the public health authority, it's more likely that the people that you work with and know, who will know how to use these data to make a difference to people's lives. So there's a whole range of people who need to contribute to these recommendations, certainly not just us as Public Health England. So we've done the very best we can to understand what the data tell us already. There are some things that we still don't know from the data, and there's a research program that has been kicked off to try and elucidate some of the genetic analyses and some we haven't done yet. But we've done the very best we can to make those data available to people so that really good recommendations can be developed, which will really make a difference to the outcome. But thank you.
Thanks. Have you got a...
Yeah. If I may ask, so you've mentioned that there will be a follow-up report inquiry. Do you have any timelines as to when that follow-up report, you mentioned it will be headed by Kemi Badnock, do you have any timelines as to when that might be? Obviously the concern on this issue is that, given the scale of the issue, it's just report after report, and obviously there are many people in BME communities who really want to see some serious action and some serious recommendations.
Yeah, I get that yearning, and we will put action in place as soon as we can. We won't wait for a report. I've got to talk to Kemi about a timeline for it, and so I'll have to get back to you on that one. But I totally understand the urgency, the importance, and the sensitivity of getting this right. Thanks, Vic. Thank you very much indeed. That ends today's Downing Street Coronavirus Daily Briefing.
That's the Health Secretary under a bit of pressure there over the review into BAME deaths. He addressed the black and ethnic minority workers.
Well, guys, that's Matt Hancock's speech. This is part 2 I've done. I would have done a bit more to it, but the phone crashed. Thank you for joining me, and I'll see you in the next one. Peace.